This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hello and welcome to Horsin Around. I'm Dr. Chris Blevins at Kansas State University Veterinary Health Center. Today, joined by Dr. Dylan Lutter. He is a board-certified surgeon here in large animal at Kansas State and assistant professor, and does a lot of the emergency work here at the vet school. So welcome.
Thank you for having me.
I think that something that's always important to go through that a lot of horse owners, they're very leery about is colic surgery, or if a horse would need to go to colic surgery, some maybe misperceptions of that, or just being comfortable with that situation and potential options for that. So could you go through kind of if an owner or even that referring veterinarian is getting ready to potentially refer maybe to you at night or even during the day, when is the best time to try to figure out when surgery may be a needed option?
Sure, Chris. That's a very common question we get, and a lot of people have a perception that the colic is really bad. It may not be worth going to surgery, and I think the most important thing to keep in mind is the sooner that we can get the horse here, the better. Once it sort of becomes evident that this is not just a routine run-of-the-mill colic that one vet visit isn't going to take care of.
And with that, and as you move forward, what are some different colics that happen? And you don't have to go through the whole gamut, maybe just a few of the more common ones that are on the surgery table that you've been dealing with here at Kansas State.
Sure. Well, certainly the most common one that we see here are large colon impactions or displacements. So basically the feed material in the colon becomes really dry and it just gets stuck in there, or the colon moves to the wrong spot. That's one of the most common that we see here. And then the other aspect would be a large colon or a small colon twist, where something twists and cuts off the blood supply, and then we may need to go in and take that part out. So.
And I think that's something where, too, some owners think, well, if you take out part of the bowel, that horse isn't going to do well. What's the aspect when you have that conversation? Maybe there's devitalized small intestine or large intestine. What is that kind of communication with the owner dependent on, I guess?
Sure, it is situation dependent, but a lot of times we look at how sick the horse is before going to surgery and try to get an estimate of what sort of complications might occur, because that can really affect how the horse does after surgery. But if the horse is relatively stable and we're able to take the devitalized piece out, actually around 70 to 75% of horses, depending on the procedure we do, sometimes it's less than that, can actually go back to doing what they're doing and go back to being normal horses. So it is definitely a worthwhile procedure.
I think that's stuff that owners need to remember is just because they're going to go to surgery doesn't mean they're going to have a life-changing situation where they can't go back to. It all depends on the colic, obviously, but success rate can be fairly good, and it's definitely better than just a 50-50 chance.
Oh, definitely. Well, and especially for the displacements and impactions that I mentioned, that can be up greater than 90% chance. So it's worth having that in mind.
Yeah. Well, thank you, Dr. Lutter, and giving us the information on colics and colic surgeries. And I guess if people have a horse that's needing colic surgery, you'd be talking to one of the surgeons here at the vet school, maybe even Dr. Lutter. But it's one of those things where we're here if you ever need us.
That's right, we're here. Feel free to give us a call.
All right. Well, thank you, Dr. Lutter.
Thank you.
I'm Dr. Chris Blevins for Horsin Around, and we'll see you around.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.